Meet the Problem Solvers. I'm Judy Perlman. In these days of COVID-19 really taking over so much of our lives internally and externally, we're focused in this series on addressing concerns that are very real for people. And so our series today focuses on the emotional and psychological elements of life under the COVID restrictions and uncertainties. My guest today is Laura Hutson. She's a clinical social worker at the Boston Healthcare for the Homeless program. Thank you for joining me, Laura. Let's dive right into it. Help us put some language and some parameters on what it is we may all be going through right now.
Sure. Thanks so much for having me, Judy, and thank you for diving into this segment and sort of exploring together how we can best support each other and also support ourselves too. So to answer your first question, I think that really important to acknowledge that all of us are under tremendous stress right now and likely experiencing a lot of grief. I think what's tricky about grief is that people often associate grief with death, which is true. And also I think it can be expanded to grieving the loss of a lot of things right now. It could be loss of structure, or routine, loss of hobbies or activities, in some cases loss of jobs, and in some cases too, loss of family or friends. And I think that can also create a tremendous amount of stress and come out in different ways that we might not know how to put words to. Some ways that grief or stress present itself is that you may find that you're feeling more down or irritable than usual. You may find that you have a difficult time concentrating on tasks. In some cases, you may even find yourself feeling numb. And I think a really important part of self-care and being kind to yourself is allowing yourself to recognize what might be happening, calling it grief, calling it stress, putting a name to it, and normalize what you're experiencing.
Yeah, and another part of a very real part of what we're all going through is this kind of sense of isolation where our lives are much more constrained, and also this loss of control. A sense of we don't know what's going to happen next, and even a loss of kind of a sense of trust and knowledge that somebody out there really understands what's going on and is telling us in a planful way. Everyone kind of figuring out anew what's going on. I guess as you and I have talked about, that kind of uncertainty can really reverberate even more for people who have been struggling with mental health or substance challenges before as well as during this time of COVID. And we wanted to talk about sort of speaking to those people, but also speaking to people who are concerned about people in their lives. What are some productive ways to reach out and offer support? So thanks for taking us into this next piece.
Yeah, of course. So if I were to venture a guess, I think that if we have folks in our lives that we're concerned about, I doubt that concern is new with coronavirus. I imagine instead that it's probably amplified with coronavirus. I think a really helpful first step, and it sounds both obvious, I think it's really helpful, is reaching out more to those that you're concerned about, making a phone call, doing a Zoom chat, and reaching out more, and calling and saying, hey, I'm feeling really anxious during this time. I'm feeling really angry, and allowing it to be a point of connection. And also asking the question of saying, hey, I imagine you might be experiencing these same things. How can I best support you during this time? And you may also find too that you might receive support from reaching out to and being able to say, hey, I would really appreciate if you could support me in this way this time, and having it be a two-way street. As even before coronavirus has been present, I think that solidarity is one of our greatest strengths, and I think that it's even more so true now. Just that solidarity is we're doing that in more creative ways of connecting to one another.
Mm-hmm. And not just reaching out once and saying, I did that, but telling the person, I'm going to continue to reach out. I want to see how you are doing, and I hope that you'll do the same, and sort of opening up that pathway is another thing that I think can help people feel less alone.
Absolutely.
And to say, hey, if you need a friend to talk to at any time, if you're concerned about your well-being or you're concerned about, I mean, in some cases, if you're concerned about your use of alcohol or drugs, please feel free to call and I'll support you the best I can. I think it normalizes what we're all going through.
Absolutely.
So let's talk about helping ourselves and helping our loved ones with some interest, with some strategies. What are some strategies that we've generated?
Sure. Judy, I think you made a really good point earlier that during this time we're getting a lot of different information. I think this time feels like there has been a loss of control in a lot of ways. And I think that a great way to care for yourself is focusing on what is in your control. Maybe that's deciding to go take a walk around the neighborhood. Maybe that is, using all of these apps at our disposal right now for exercise. Also, too, taking breaks from the news and social media can be extremely helpful, and can remind ourselves that to a large degree, or to some degree, we do have control over how much information we're taking in about coronavirus. I think we do a really great job of trying to quarantine ourselves sort of physically, but I think there's an aspect that could apply to our emotional health too, of taking a break, saying, hey, this is going to be a coronavirus free zone, to take a break and give yourself a break. Yeah, I think those are a few examples.
Those are good ideas. Well, another thing that we know is that a lot of groups, support groups, have moved online, and so there are online smart recovery groups, Alcoholics Anonymous, and other 12-step programs. A lot of programs offer Zoom platforms or other platforms to stay connected, and talking to people who are grappling with the same things that we're grappling with can be really helpful. So that was one thing that we also wanted to make sure to say is look for those.
Absolutely. I think too, during this time, a lot of healthcare providers, a lot of therapists, counselors have actually moved to something called telehealth visits, or visits that are done over Zoom or by phone call. And I think that's really important to know that during this time, people may find that if they're connected with a therapist, I think they have to disconnect. And it may actually be the opposite, that in a lot of ways, therapy may be more accessible now, either if you are looking to continue with the therapist that you're seeing or you're looking to start. Know that telehealth is available. Also, some insurance companies too have actually been waiving co-pays for telehealth visits, which means that nowadays even access therapy for free from your home, which is really amazing. I think a helpful resource to know.
That is amazing. I was so thrilled to hear that from you, and I hope that will be helpful to other people.
Mm-hmm.
And in some maybe a less structured way, there may be times that you want to just talk to somebody. So there are things called hotlines, and there are things called warm lines.
Mm-hmm.
Maybe just help us understand the difference.
Sure. So hotlines, I imagine a lot of people have heard of, and we actually wanted to provide some resources there. If either yourself or one of your loved ones, friends or family might be in a crisis situation, there are hotlines available. If there is sort of an immediate safety concern, of course, call 911. If you're in the Boston area or in surrounding areas, there's something called the BEST team, the Boston Emergency Services team, that will provide on-site evaluation and treatment and referrals for folks that may be experiencing a mental health emergency. And their number is 1-800-981-4357. Judy also mentioned 2 warm lines that, different from hotlines that are used during a crisis situation. Warm lines are where if you'd like to talk to someone, but it may not be a crisis situation, but you'd like to process or just have someone to connect with. There are phone numbers out there that will connect you to someone to chat, in some cases even peers, like peer support lines.
Right, and we have a phone number for a warm line that you can call if you're in Massachusetts. It's 877-733-7563. And I also have number for a national hotline where things are hotter. That's 800-273-TALK, TALK. Well, Laura, I think we're about at the end of our time. I really want to thank you. I guess my takeaways from this whole working on this episode is acknowledging how stressful this is on me and on everyone in my life. And it's making it easier for me and others, I think, to reach out and just express solidarity and consistency with others. And don't be afraid to do it. You probably won't be bothering someone. If they do feel bothered, they'll probably let you know. Any other closing thoughts or exhortations from you?
I don't think so. Thank you so much again for having me, Judy, and I hope that folks will be kind towards themselves during this time and find time to band together. So thank you so much again for having me.
Thank you, Laura. Take care.
You too.
My guest today is Brittany Jones. Brittany works as an associate social worker in LA County, Los Angeles, California. She works there with justice-involved individuals. Many of them also have mental health diagnoses, and almost all of them have histories of trauma and other barriers to well-being. Our show today is really dedicated to COVID-19 and its effect on fragile populations like the one that Brittany works with, and also thinking about the systems of care by which we are hopefully supporting people with these challenges, and talking a little bit about what we've learned about the robustness or the fragility of our ability to serve people. So Brittany, thank you very much. Welcome to Meet the Problem Solvers.
Thank you so much for having me on. How are you?
Good. Worried. I mean, I think we're all worried. And as you and I have talked in preparation for this show, I feel really worried about the number of people who are fragile and vulnerable. In fact, I'm going to take a minute and just put up a slide that really speaks to the number of people at risk. What we see here is that 13% of adults have mental illness, and 5% of adults will be incarcerated in their lifetime. So these very, very challenging effects affect a lot of people. So Brittany, tell us a little bit about your program that you've been running, and let's just dive right in. Or not,
Yes.
what you've been working in.
Yeah, so I currently work with Department of Mental Health contracted agency over here in Los Angeles. We work with individuals who have a history of incarceration, have mental health diagnoses, and are released out into the community to receive community mental health. So typically they come out, they're placed in interim housing sites where they can stay, get some care, and they come receive therapy, medication if needed, and also attend groups to help them with developing a mental health toolbox so that they can be successful out in the community.
So a group of them come right out, out of incarceration into what you call interim housing. And as we talked about that before, that's what we think of as halfway houses, sort of maybe 2 or 3 people sharing a room, congregate meals. Is that the model? I mean, is that what we should be envisioning for that group?
Yes, for the most part, it is like a what we traditionally would think of as a halfway home. People are sharing rooms. They receive their meals. They might do some groups there, but primarily it's a place for them to live and stabilize before they get independent housing. So the program that I'm working with actually is a housing first model. And that means that we're trying to provide people with the skills and the resources to get them into housing, permanent supportive housing where they can be successful, live on their own, potentially, and have a space for themselves. So that's the goal. When they first leave being incarcerated, they primarily are in these interim sites, though, however.
And then some group of your clients then move on to their own independent housing, and you evolve your support for them.
Yeah, so after a few months, a lot of the clients end up doing treatment with us, coming in, meeting with us, and we kind of make a plan for them to move into housing. So they receive a third-party voucher. It partners with landlords here in the city, and we're just able to get them housing in the community.
Right.
So we always want to make sure that they're supported. We check in with them. We help them learn how to do things like paying rent and getting your bills and making sure that their social security is turned on and all that kind of stuff if they do receive
Right.
it.
So let's just as we sort of think again about what your program kind of as a microcosm of social services that serve an awful lot of people in this nation. There's a mix of a housing, a place that they're living. There's a mix of support for them, building their own income or building their own individual plan for their own future. But there's also a lot of therapy groups, support groups, all kinds of things that your organization is the fabric that is really trying to help them move outward with greater independence and health.
Yeah, so that's very true. Not only do we provide that support with the housing, we also do provide groups, whether those are mental health groups, substance groups as well. We really try and support them. And then there is the component of the kind of like case management, daily tasks, making sure that they can get to the county buildings to get, if they need EBT or if they want to sign up for Social Security benefits. So we really support them through that process because it is a multi-level process and it can be very challenging.
So I don't mean to cut you off, but I mean, let's just think about what COVID-19 has done in all of our lives. I mean, one day we were out in our offices and working, and then all of a sudden we were told to shelter in place, stay where we are, and really to minimize contact through social distancing. So
Right.
I think I'd like to ask you to kind of put us in the picture of how the COVID-19 like arriving has so drastically changed the lives and well-being of the clients that you've been working with.
Yeah, that's a great question. So, here in Los Angeles, we really started to get a lot of information about COVID-19 at the beginning part of March. So, we were trying to continue with the groups. I would say on a Friday, we were doing the groups, but we were because we were trying to keep some normalcy for the clients. And then by that Monday, all the groups had been canceled. By that point, the Social Security building and the county buildings were all closed. Those individuals who were court involved, the courts went down to only doing a few appointments. So basically, their framework, and that's one of the things that we talk a lot about with our clients as far as like mental health. It's important to have a routine and a schedule and, be able to like do task to task. All of that was basically canceled or closed or moved around. So a lot of our individuals that I work with, the clients, they either had to stay in their interim site, basically with everyone. So the interim sites also locked down, saying that people couldn't really come in and out, or those individuals who are in permanent housing independently were told to stay in their house. So
Right. So either they were crowded and crowded in without the ability to really go outside, or they were individually isolated.
yes.
Let's talk about communication, which is such an important part of the way that you, and in fact, if we are thinking about the larger social service system, communicating with clients and with clients' ability to communicate with you and with each other and be part of groups. Talk a little bit about how that has changed and your view of that.
Yeah, so that's actually one of the bigger challenges of this situation for our individuals who are in interim sites. I would say probably 2 or 3 days after a lot of the offices started to close, we attempted to try and get them on Zoom. Now, Zoom is a really beautiful thing, but everyone doesn't know how to use it. Each site is supervised independently, and there was no training prior to when we had to roll Zoom out. So a lot of sites were unable to pick up Zoom, figure out how to connect us with the clients through Zoom, which was a challenge. Because the people we meet with like regularly, we want to check in on them, safety plan, and that kind of was not able to happen because we weren't allowed to leave the office and meet because we had to participate in social distancing, which is understandable, but it made it very challenging to service those clients. Now, the individuals who are independently housed, that also had a unique set of challenges because a lot of those individuals might not have a cell phone, or they have phones that they get from the county building that turn off, so they don't have um, consistent communication devices. And that being said, even if they do, they might not be able to use them without support, which makes it difficult for them to not only communicate with us, but also the county went from being open, having the offices open, to suggesting everyone gets online and files their claims and takes care of things there, which they didn't really have the access to.
Right. So not only were you guys on the staffing level facing your own steep learning curve with Zoom, but you were also trying to support clients who may or may not have had access to phones or computers, and almost certainly did not have a lot of support or training to go into these new things. And also what you had mentioned is that a lot of people are in that long sequence of applying for things like Social Security insurance for their disability. And so at some point, like something else is needed from them, but they may not know what is needed, and they may not be able to get into the system to move that forward. So that's another level of anxiety for them. Where is my money? Is my money going to come? Is my claim going to move forward? Where is this, and who's going to help me understand this? I mean, the level of anxiety for some of your clients, and for anyone who is suddenly shut out of their social service network of support, must be enormous. So in our remaining few minutes, can you just give us some of the thoughts that have occurred to you as you think about, going forward? What are some of the really practical ways that we need to be better prepared to support clients?
Yeah, so this is something we talked a little bit about when we spoke, and there are a lot of things that I think, in the future we need to have some plans so that, I'm not saying COVID-19 will come back or anything like that, but what if it's a local crisis or something where offices have to close? We need to have some form of stability for the individuals who need it the most. So one thing I think would be really effective is finding ways to disseminate information to different groups. So like we were talking about, a lot of the people I work with don't have cell phones, or they might not have reliable phones. So, receiving a call and getting that information can be challenging. Some people might not have TVs. We just need to figure out a way to make sure that all information is given to everyone, whether that's information about what's going on with the office or just general information about the CDC guidelines. Because if you're not really watching television, it's really hard to know exactly what you need to do and what is fact versus fiction. So that's one piece, I think. And then another piece is, providing training and support, and even maybe devices for technology. Like if we're going to expect individuals who are filing claims with the county or Social Security to be able to switch onto the internet and file those claims, they're going to need support and training. And this crisis really illuminates the fact that without the support of maybe a case manager or a therapist or someone else that they work with, a lot of individuals don't know how to actually look on the computer. So we need to find a way to give them support, actually give them the devices, and make sure that they're ready just in case there is another crisis.
Yeah.
And last but not least, I think making sure that we have emergency plans for individuals. It's always good to emergency plan, and we want to make sure that not only we do a lot of safety planning as far as mental health, but just emergency planning in general. Like, who is it that I can reach out to? Where can I go if I need additional food or support, or just like so that everyone has an idea of how to best support themselves when we're in a time of social distancing. Not to say that we're not still supporting them in a viral capacity or virtual capacity, but finding that support in their communities as well.
And so you're really talking about preparing now that, here we are, sadder but wiser. COVID-19 changed everything very quickly, and you're making some recommendations about being more prepared with tools and equipment, being more prepared with training and support, and helping clients be prepared with some of the information they may need to use, not only on the practical level, but also probably on an emotional and just kind of human contact level.
Yeah. I think just making sure they know, that there is support and that there will be, it'll be challenging, but there is a tomorrow, and to provide hope. People tend to feel a lot of hope when they have some preparation and they have some consistency. So we want to provide that when we're in a good time. So when a challenging time comes around, people do have that support and something to look into.
Right, and I will just say that one of the reasons we decided to do this show in this way was because we do know not everybody has a phone or a computer, but some people do have TVs. And so we're hoping that this will get out to folks, not just in Cambridge, Massachusetts, but also really to other people who are at home and wondering what to do as they face this. So Brittany, thank you. It's really nice to meet you virtually.
Yes, thank you.
And look forward to meeting up on the other side of COVID-19. I hope you
Yes,
stay well.
thank you so much. Thank you for having me on.
Okay, thanks.